Would you ever get plastic surgery for a man? Well, Julia Fox is on record saying that she would and that she has had plastic surgery. Let's get into it. She was recently interviewed by Allure magazine. So Julia has always been vocal about the procedures, injectables that she's had done, which include Botox, fillers, veneers, rhinoplasty, and liposuction over the last 10 to 15 years. Last year at the Tribeca Film Festival, she was quoted by saying that she feels like honesty is the best policy and that she just wants to be honest about what she's had done and that it's important for women to set the bar for each other. And she feels like you're setting an unrealistic bar for beauty if you aren't being honest. And as a plastic surgeon, I wholeheartedly agree with this. I think if you are willing to share your experience, it's actually very empowering for yourself and everybody around you. That being said, Julia does have a lot of regrets about plastic surgery procedures that she's had done. She starts by talking about her first plastic surgery procedure, which was a rhinoplasty that she had done when she was in high school. And she said that she did not listen to the doctor's orders and she went out all night the night prior to her surgery. And she was actually really afraid because she had a very high blood alcohol level in her system before undergoing the rhinoplasty. She describes the experience as waking up during her procedure, but she also felt paralyzed at the time and she could hear her bones in her nose being broken. In addition to her rhinoplasty, she's had veneers and she's also had liposuction. In terms of Botox and fillers, she states that she started doing these procedures when she was really young, around 21 years of age, and she felt influenced by people around her in terms of trying to be relevant and the most beautiful version of herself that she could be. She states that when she was dating Kanye West, he offered to pay for a breast augmentation or a boob job for her, but she said that she still feels very self-conscious about the appearance of her breasts and that when he suggested she have surgery, that his words stuck to her like a piece of lint and she could not shake the uncomfortable feeling. And throughout this article, Julia is very candid and open about how she feels about all of these procedures in retrospect. And the main takeaway here is that she wishes she could take some of this back. And specifically, she wishes that she could reverse the procedures that she had done, which were catered toward men in her life. She states, now when I see someone who looks natural and beautiful, and I can tell they've never had anything done, I wish I could go back and be that person. So as a plastic surgeon, I have a lot of thoughts regarding this article. First of all, I think it's really brave of Julia to come out and just say, let's talk about it. This is what I've had done. This is why I look the way I look. And these are my feelings towards the procedures that I've had done. Ultimately, her biggest regret is having something done because she felt like she was pressured to look a certain way or to impress a certain man. And ultimately, when I am screening patients for plastic surgery, it is really important that the patient and I are on the same page and that we're doing this procedure to improve the patient's self-confidence and that they are not in any way being influenced by someone else.